welcome to Doctors on TV. Another episode, another learnings. Kaya naman mga kasambahay, tutok lang sa ating episode for today. And before we go to our topic for today, we would like to remind you mga kasambahay, don't forget to follow and subscribe on our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just have to type youtube.com/@doctorsontv. And you can actually send us questions and comments sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong mga friends. And before we proceed, alamin natin kung bakit nga ba dapat na huwag ipagsawalang bahala kung ikaw ay may nararamdamang hindi normal sa inyong mga mata. Let's watch this.
Did you know that vision impairment can lead to a lower level of educational achievement? Globally, the leading causes of vision impairment are age-related macular degeneration, cataract, diabetic retinopathy, glaucoma, uncorrected refractive errors. According to World Health Organization's 2022 data, the impact of vision impairment to the young children with early onset severe vision impairment can experience delayed motor, language, emotional, social, and cognitive development with lifelong consequences. While adults with vision impairment often have lower rates of workforce participation and productivity and higher rates of anxiety. It can also contribute to social isolation, difficulty walking, a higher risk of falls and fractures, and a greater likelihood of early entry into nursing and care homes. So we must pay attention to vision impairment because our eyes plays a big role in our lives.
Kaya mga kasangbahay, mahalaga po na pangalagaan natin ang ating mga mata. Kung may nararamdaman, kumonsulta po agad sa ating mga doktor para sa proper check-up and diagnosis. At bago pa lumalim ang ating usapan, may makakasama po tayong guest doctor maya-maya po lamang. Kaya wag po kayong bibitiw. Tutok lang mga kasangbahay and we will be right back after this short break.
Tulad ng ibang karamdaman, dapat nakahanda tayo sakaling magkasakit ng COVID-19. Ito ang mga dapat isama sa COVID-19 Home Kit: thermometer, oximeter, pain relief medicine tulad ng paracetamol, gamot para sa dehydration, disposable face masks, sabon at sanitizer, disinfectant spray, disposable gloves. Para sa iba pang mahalagang impormasyon, manood ng Life Saver dito sa UNTV, your public service channel.
Mga pagkain na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Ayon sa WHO, mas madaling kapitan ng COVID-19 ng taong mahina ang immune system. Kaya payo ng DOH, kumain ng prutas, gulay at root crops para mapalakas ang immune system. Ang kamote at ang talbos nito ay dalawa sa mga inirekomendang pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ng impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Different medicines are invented to take care of our heart. But still, laughter is the best medicine. Why? A good laugh causes the tissue of our blood vessels to expand. It could increase blood flow by 20% throughout the body. Stress, on the other hand, constricts our blood vessels and reduces blood flow. Laughter makes our heart's job easier. Try to laugh more often. For more healthcare tips, watch UNTV, your public service channel.
And before we introduce our guest for today, mga kasambahay, gusto niyo bang malaman ang sikreto paano mapapanatili na healthy ang ating mga mata in a natural way? Learn that here at Naturally Yours.
Hello mga kasambahay! It's another Sunday morning and it's another opportunity para po magkaroon ng kadagdag kaalamang medical. At ngayong araw ay ating itatalakay ang tungkol sa glaucoma, isang sakit sa matang bumawi sa paningin ng halos 60 milyong tao sa buong mundo. At sa ating bansa, ito ay itinuturing na pangunahing dahilan ng permanenteng pagkabulag. Kaya naman, alamin natin paano nga ba ang dapat pangalaga ng ating mga mata nang hindi kailangang gumastos ng malaking halaga. Tara! Join me mga kasambahay and let's learn the how to keep our eyes healthy. Ano ba ang dapat natin gawin? Number 1, iwasan po natin yung eye trauma. Ano ba ang mga eye trauma? Number 1, yung ating pagbabasa, panonood, o nakaharap tayo sa computer. Kailangan po eye level. Bawal po yung mga nakahiga o hindi nakapantay sa ating mata yung ating po mga binabasa. Sobrang pag-ehersisyo, hindi masama na gumalaw tayo, pero kailangan po, lalo na po tayo may mga issue na nagsisimula na lumabo ang ating mga mata o masakit ang ating mga mata, ibig sabihin, nagkaka-pressure na, kailangan natin kumonsulta sa ating po mga dalubhasa, sa mga medical practitioner, para po alam natin kung anong tamang ehersisyo sa nagkakaroon ng glaucoma or bago pa nagkakaroon ng glaucoma. At kung tayo po naman ay gumagamit ng mga artificial or contact lenses or ibang kulay sa ating mga mata, ay kailangan po meron pong advice ng mga ophthalmologists, optometrists para po dapat tumatama at hindi po magkakaroon ng stress or pagpapahirap sa daloy ng dugo at ng tubig sa ating mga mata. At maliban dyan, bukod dito, marami rin naman po tayong mga pwedeng gawin na pagkain na makakatulong sa atin para manatiling malinaw ang ating mga mata. Ito po yung pagkain natin na, siyempre, the more colorful, the better. Lalo na po yung mga madidilaw, yung mga orange sa pagkain na mataas sa vitamin A. Yung po ating mga antioxidants, yung mga berries nating available na mga fruits and vegetables ay kailangan meron sa ating diet. Kasabay nun, pwede po nating enhance na mga gulay, na mga deep greens. The more green ay mas makakatulong din po para gumanda at umayos yung mga blood oxygen. Meron din po mga natural herbs and supplements na napag-aralan at kailangan pa pong gamitin kung hindi man po natin nakukuha sa ating kinakain. That also helps our eyes as healthy as possible. Ang ilan po dito, number 1, yung mga na-mention natin mga antioxidants, yung mga bilberry, yung pong mga ginkgo biloba, at yung po mga goji berries ay matataas ang kantidad ng mga antioxidant, phytocyanins, phytochemicals na tumutulong po para sumigla at hindi po magkaroon ng pagbabara o di kaya pagpapahirap, pagkikipot ng mga ugat or optic nerve sa ating mga mata. Kasabay din po niyan, syempre kailangan po natin na tayo ay natuturing natin nakaka-6 hanggang 8 oras na tulog araw-araw. Kasabay din yan yung ating regular na pag-inom ng tubig para po hindi nakukulangan ng blood oxygen, kaya hindi po nahihirapang mag-pump or magkaroon ng stress yung ating mata. Mga kasambahay, iyan ay ilang lamang sa mga information on how to keep our eyes healthy and sharp. Muli, in behalf of Dr. Jason Sanchez, ito po si Doc Bunny Bernardo, isang naturopathic practitioner. Until next Sunday, mga kasambahay, for more natural and useful healthy topics, because natural is beautiful at naturally yours.
And for today's topic, makakasama po natin si Dr. Maria Zita Zagala-Meriales. She is an ophthalmologist from Makati Medical Center to help us understand more about glaucoma. Hi, Dr. Mitzi!
Good morning,
Welcome to
Doktora.
Doctors on TV.
So nice to be here.
Yeah, thanks no, na pinaunlakan niyo po kami dito.
Yes.
Naku, napakarami po nating matutulungan sa ating tatalakayin ngayong araw.
I hope so too.
Yes, Doktora. And ito po, no, sa panimulang katanungan po, Doktora, ano ba itong glaucoma? Kasi lagi, di ba, ang dami nagkakaroon nito. Tapos, basically, yung iba po, wala silang idea what actually it is and marami bang naaapekto? Ano po yung causes?
Oh, okay. Now, glaucoma kasi is one of the more common eye diseases. Ang naapektuhan dito ay yung ugat, the optic nerve. Para sa ating kaalaman, ang glaucoma ay isa sa pinaka-common na sakit sa mata. Ang naapektuhan sa glaucoma, Doc Sara, is the optic nerve. And itong optic nerve, yan ang nagdidikit sa mata. Yan ang koneksyon ng mata papunta sa utak o sa brain. So, siya yung nagde-deliver ng vision signals to the brain. Now, sa glaucoma, nagkakasakit ang ugat. At ang resulta nito ay mawawalan tayo unti-unti ng paningin.
I see. Pero Doc, ano po yung pinaka-cause ito? Ano yung sanhi? Bakit nagkakasakit itong optic nerve?
Okay. Ang optic nerve dapat yan, maganda ang kanyang pinagtitirhan, let's say, no? So, unfortunately, in glaucoma, kalanasan, tumataas ang pressure sa loob ng mata dahil nagkakaroon ng build-up ng fluid. Now, because of this build-up in the fluid, Doktora, na pipisa ang ugat. So, pag napisa ang ugat, nababawasan ng kanyang abilidad na magdala ng signals papunta sa utak and eventually na uunti-unting maupos ang ating paningin.
I see. Pero Doktora, you mentioned about nagkakaroon po ng build-up ng fluid, okay, dito sa area.
Yes.
Ano po yung nagiging cause nito? Bakit nagkaka-build up?
Kadalasan, no, as we grow older, yung drainage system, para yan sa mga tubero sa plumbing, we do have a drainage system inside the eye. Dapat yan, maganda ang daloy ng tubig. But in glaucoma, over time, yung drainage system na yan ay nagbabara. Nagiging hindi maganda ang kanyang pagdaloy. So, nag-iipon ang tubig sa loob ng mata, hindi makalabas. So, the pressure builds up and it now presses on the optic nerve.
I see. And meron po bang mga conditions na, pwedeng maging dahilan bakit nagkakaroon ng, failure po dito or hindi po nagiging mas functional yung drainage system ng mga fluids po dito around the area?
The most common type, which is the open-angle type of glaucoma, we really do not know the exact reason why the drainage system fails.
I see.
So, it usually happens, ang kaya importante is to know the risk factors. So, kung ang magulang mo ay mayroon, you have most probably baka maging dysfunctional din yung drainage system mo. And as we grow older, because meron rin damage, no, as we grow older, mas maganda magpatingin din, no. So, we cannot tell right now the exact reason for those primary causes. But yung mga secondary causes, meron tayong mga pagdugo o pagmamaga na maaring mag-block doon. And there's also another kind wherein yung angle closure na yung drainage system mismo natatakpan ng isang tissue, kaya hindi makadaloy ang tubig.
I see. And usually, Doktora, those patients who are actually diagnosed with glaucoma, pag pumunta sa clinic ninyo, kalimitan ano po yung ano yung presentation nito? What are the signs and symptoms that they actually manifest?
Okay, ang symptoms, madalas, wala. Which is very difficult, no?
So parang incidental finding po ito at times?
Yes, a lot of times. Kasi yung glaucoma, mabagal na sakit. It develops slowly over time. So, hindi mo nararamdaman. Tapos, ang naapektuhan madalas ay yung paligid ng paningin. So, kung paligid lang, hindi napapansin rin yan ng tao until yung vision niya pumunta na sa gitna at doon lang napapansin. Kaya madalas, walang symptoms. And we usually diagnose glaucoma only in a routine eye exam. However, if some patients do have symptoms, ang laki ng range. It can be very dramatic, nung tawag naming acute attack, wherein the eye is very, very red, tapos masakit ang ulo, masakit ang mata, nagsusuka, tapos talagang biglang labo. That's the very dramatic acute attack. Or it can also be less, yung mga parang mabigat lang dito, mabigat lang yung mata, or parang yung sa ilaw, nagkakaroon ng halo. So, there's a big range. So, but more often than not, walang nararamdaman.
I see. But, you mentioned po kasi na most of the time, this can be an incidental finding only, no?
Yes.
And what if hindi na-diagnose early on? And does this have a chance of getting, or does this increase in severity eventually? Mas nakakatakot ba pagka lumalala ba siya? I mean, kapag hindi ka agad nalaman?
Yes, Doc Sarah. Yan ang malungkot sa glaucoma, no? So, hindi siya unang nagpaparamdam. Pero over time, para siyang nagugulpi yung ugat mo. Parang ginugulpi yan na unti-unti. So at the end, pag na matagal na at hindi mo napansin, yung ugat mo, as I said a while ago, parang naupos. Para kang na boxing ni Pacquiao, na doon ka na sa final round. Parang, na siya, lupasaysay. So you will get blind. There is a big chance of getting blind if glaucoma is unchecked and undiagnosed and untreated.
Of course, this is very sad,
Yes.
no? Hindi mo magugustuhan talaga na tayo ay bulag na.
Gusto mo round 1 pa lang,
Yeah.
malaman na, para sa round 1 pa lang, maano mo na makontrol.
Okay, so this tells us na dapat talaga inaalagaan natin ang ating mga mata, no? Okay, but before I proceed there, dun sa katanungan about like taking good care of our eyes para protected din yung vision natin, I'd like to ask, kasi you mentioned about the increase in intraocular pressure a while ago, na mataas yung pressure doon, di ba po? Pag nagkakasakit yung optic nerve then because of the, yung parang poor drainage, kaya nag-build up yung mga fluids. Having mentioned about pressure, ito po ba di ba meron tayo pagka-hypertensive or mataas ang blood pressure ng isang individual, di ba? Meron din ba itong can it be a risk factor also?
Well, typical risk factors for glaucoma is one, we notice it to be more common in the older population. So pag medyo may katandaan na, magpatingin, no?
I see.
Also, as I mentioned a while ago, kung merong mga kamag-anak na may glaucoma, magpatingin na rin. May mga sakit ng diabetes, lalo na pag hindi controlled, magpatingin din, no? Kasi yun ang nagkaroon ng glaucoma. Ang iba pang mga factors, kung kunyari kayo ay nasuntok sa mata, o nagka-aksidente sa mata, o may naoperahan dati sa mata, that is also another risk factor for developing glaucoma. Lalo na rin yung mga matataas ang grado, whether far-sighted or near-sighted. So yun yung extremes, risk factor din yan for glaucoma. And ethnicity, yung mga Asians and Africans, they have peculiar findings na may konting mas meron silang chance na magkaroon ng glaucoma. So we are in Asia. So we are at risk.
Okay, so mga kasambahayan, narinig po natin yung mga risk factors po na yan. Okay, and talagang kanina naman nai-emphasize ni Dr. Mitzi kung ganong kahalaga na early on, yan po ay ma-diagnose ka agad para maiwasan natin yung nakakatakot na blindness, no? Kapag, if it gets severe, okay, later on. And Doktora, ito kanina, na-mention din natin about blindness. So apart from that, what happens ba pagka meron pong glaucoma? Ano pa po yung ibang mga pwedeng outcomes? Okay.
Ang talagang ultimate outcome is blindness. We have 2 eyes, no? So, usually in glaucoma, may isang mata ang mas naapektuhan una kesa dun sa isa. So, ang vision mo, lumiliit. Lumiliit yan from the side. Tapos, paunti-unti niyang tatakpan ng paningin mo hanggang makarating sa gitna.
Sa gitna.
And then that is already terrible. Pag nasa gitna affected ka na talaga.
I see.
So, kaya hindi rin napapansin yan kasi ang mga tao naman, hindi nila chine-check. No? People don't go around checking their vision like right and left. So, the other eye compensates. Kunyari, isa mas madala. Yung isa, okay pa, siya yung nagko-compensate for the poor vision. Until finally, they see, ay, parang bakit hindi na ito? A lot of our patients na malala, sometimes they come in too late for the other eye, but we have a chance to save the other eye.
Okay, Doktora, if I may interrupt you, you mentioned about kanina yung nasa gilid. So, can we educate our viewers, diba, yung may peripheral vision tayo, yung kumbaga parang kahit dito ako nakaharap, meron akong nakikita somehow na aaninag sa gilid ko. So, yun po yung peripheral vision.
Yes, that's the peripheral vision.
Okay, and then yung diretsong nakikita ko, this is the central vision. And then yung sinasabi niyo po na isa sa mga outcomes of glaucoma prior to getting blind, pag hindi po na-resolve, hindi na-ayos, hindi na-manage right away. So, basically, ito po yung nawawala, dahan-dahan, until such time, pagka nag-increase ang severity, pati yung gitna, lumiliit na po ang vision. Tama po ba, Doktora?
Yes.
So, nakakatakot,
ang
Doktora.
nakatakot talaga. Tapos minsan, ang matitira na lang, itong napakamaliit na island dito. So minsan, talagang tagilid na lang sila tumingin. So you can imagine, how do you eat? How do you move around? How do you drive? A lot of the basic life activities will be affected.
Okay.
Driving, going up and down the stairs, reading, those things we cannot take for granted, but it is severely affected for those with advanced glaucoma.
Yeah, and of course, I understand. Syempre, lalo na yung mga senior citizens natin. Especially that you mentioned that age is really a major factor as well.
Yes.
Okay,
So,
and to continue with the other outcomes, Doktora.
Well, basically, yun ang pinakaayaw natin, how it will affect your lifestyle. So, especially here in the Philippines, we have very limited access for for the disabled.
Yeah.
So you are now going to be very, you will now rely on your relatives to guide you. So, kasi pag sentro lang ang paningin mo, yung ulo mo ngayon, ipapaling mo kung saan ka lang nakakita. So, madalas nababangga sila. So, those are the really dreadful outcomes, lifestyle change. You
And
have a lifestyle
does this
change.
apply to the different kinds of glaucoma? Kasi you mentioned a while ago na may certain types or kinds of glaucoma.
Ultimately, they have different initial causes, but they ultimately hurt the optic nerve, whose function is solely really to give you vision. So, yun ang kanilang, kahit anong klaseng glaucoma ka nag-umpisa, pag ang ugat, yun lang parehas halos ang resulta kung hindi na-control, nauupos ang vision.
But can we give our viewers, mga ating makasambahay, a very brief description and so we can differentiate yung iba't ibang klase po ng glaucoma?
Ang daming types of glaucoma. We have adult type of glaucoma. We also have childhood or congenital types of glaucoma. Fortunately, yung mga glaucoma sa bata is not very common, which is good, Yung mga childhood types or congenital glaucoma, they were born with an abnormality in the drainage system. So, paglaki nila, talagang yun ang mga mahihirap i-handle, Now, for the adult types, as I said a while ago, yung primary types wherein there is an intrinsic abnormality in time that develops that slowly the drainage system becomes clogged, those are the more common types na yung adult type, yung open angle, or yung isang type naman, yung angle closure, yung nababarahan. So, yung ganyan tipo, I can compare it to a sink. May faucet, tapos may drain. Yung open angle type, ang normal na tao, pag binukas mo yung gripo, dadalo yung tubig, lalabas ang tubig, hindi na pupuno ang sink. But with open angle glaucoma, kita mo yung drain. Binuksan mo yung gripo, kita mo ang drain, pero hindi naglalabas doon yung tubig, napupuno. So that means inside the drain, something is wrong. So that's the most common type. The other type, yung angle closure, may nakabara doon sa drain. So on mo yung water, because something is blocking the drain, water just accumulates.
I see.
But the problem with eyes, unlike a sink, water flows out. Sa glaucoma, water stays within the eye, kaya nagkaka-pressure build up. The other types, what we call the secondary types, marami din. Pwedeng dahil sa pamamaga, pwedeng dahil sa pagdudugo, pwedeng dahil sa diabetes, sa hypertension. So there are also, or even trauma, even steroid-induced glaucoma exists. So there's really a variety of types of glaucoma. But ultimately, kung ano man type yung glaucoma mo, isa ang nasasaktan. Yan yung ugat. And if the nerve gets damaged, parang yung fiber optic mo nang nagka-connect sa TV, dun sa kung sa mang cable, no? Pag naupos yung cable, wala ka nang mapapanood.
Okay.
So that's the ultimate outcome.
So, but at the end of the day, talaga kailangan early diagnosis as well. Or mas maganda kung, yung mga ating kasambahay ay may mga preventive measures. Okay, so para at least, early diagnose or mapigilan pa rin na magkaroon. Yeah, and mapigilan din yung severity if ever na ma-diagnose early on.
Yes,
no, Doktora?
that's true.
Ayan, no, mga kasambahay, much better po talaga kung ating isasama sa ating self-care routine ang pangangalaga po ng ating mga mata upang maiwasan ng iba't ibang eye diseases gaya ng glaucoma. At para sa iba pang impormasyon ukol sa sakit na ito, atin pong ipagpapatuloyan sa pagbabalik po ng Doctors on TV.
Ito ang tama at maling paggamit ng bleach kung gagamitin na panglinis sa bahay. Ihalo ang 1/4 cup ng bleach sa 1 galon na tubig. Iwasan na paghaluin ng bleach at ang mga produkto na may ammonia tulad ng panglinis ng salamin dahil makagagawa ito ng nakalalason na chloramine. Huwag haluan ng alcohol ang bleach dahil nakalilikha ito ng chloroform na makasasama sa kalusugan kapag nalanghap. Huwag din paghaluin ng bleach at asido dahil nakalilikha ito ng chlorine gas na kapag nalanghap ay makasasama sa baga. Tandaan na mahalaga ang kalinisan at kaalaman para maiwasan ang sakit. A reminder from UNTV, your public service channel. Mahina ang immune system ay kasama sa high-risk na grupo kapag nagkasakit ng COVID-19. Isang paraan para mapalakas ang immune system ay ang pagkain ng prutas, gulay at fruit crops. Ang patatas ay inirerekomenda ng National Nutrition Council dahil sa mataas na vitamin C nito na makatutulong magpalakas ng immune system. May taglay din itong zinc, vitamin B6 at isang uri ng alkaloids na mahalaga sa maayos na paggana ng immune system. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Welcome back to Doctors on TV. And still here with me is Dr. Maria Zita Zagala-Meriales. She is an ophthalmologist from the Makati Medical Center. And Doc Miss, ito medyo napakarami na nating natalakay kanina. Umiinit ang ating talakayan, And ito nga po, so talagang napag-usapan natin ano ba yung glaucoma. You mentioned also about the different types, okay? And actually, ang ganda ng explanation nyo kung paano nagkakaroon, yung pathophysiology po, or paano nagkakaroon ng, how do I say that? Nagkakaroon ng glaucoma ang isang individual, okay? Now, but of course, ito yung gusto nating malaman. Bago pa pumunta sa inyong isang pasyente and nakikita niyo right away na ito mukhang glaucoma ang diagnosis, or meron tayong mga kailangan talagang diagnostic measures just so you can confirm na ito po talaga ay glaucoma.
Okay, kasi ako kasi I'm a glaucoma specialist. So laging nasa utak ko, baka ito may glaucoma. But lahat ng eye doctor, kasi nga glaucoma is very common, they should be cognizant kung paano i-pick up. So pagkausap pa lang namin yung pasyente, sa interview pa lang, sa history, may mga tanong na kami very specific. Unang-una meron ka bang kamag-anak na nabulag? So pag meron na siyang nagsabi na meron ka mag-anak na bulag, parang na kaming teka lang, marami pa tayong itatanong. ikaw ba ay naoperahan na dati? So again, those are parang warning signs, or kung meron kang kamag-anak na laser o na nag-undergoing treatment for glaucoma. So history pa lang, doon pa lang pinipick up na namin kung sino ang maaring may glaucoma. And then, yung eye exam. The eye exam, very thorough. So, ang eye exam, ini-examine namin yan mula vision, pati grado, tapos mula harap hanggang likod ng mata. Maliit lang ang mata, pero ang daming parts. And each part, we take a look in that 8-part eye exam. Now, in glaucoma, and actually all ophthalmologists should take the pressure of the eye. Pero magpapaalam ka syempre dun sa pasyente, no? Because we are going to touch the eye, or meron naman non-contact, we call tonometers. And these tonometers will get the eye pressure. And then, after that, we also examine the nerve. Meron kami sa clinic, meron kami maliliit na lente, no? Na hindi naman itatouch yung mata mo. We can take a look from afar, well, not really very far, no? But meaning no contact. We can take a look at your nerve and see kung merong mga itsura na parang may glaucoma ito, no? So, if after the eye exam shows na you have definite glaucoma, let's say taas talaga ng pressure, ay talagang meron, no? O kaya yung ugat mo parang suspicious or talagang meron damage, then at that point, we decide, no, to do diagnostic tests. We also have lenses that will take a look at the drainage system. So, yun, hinahawakan namin ang mata, pero may anesthesia, no? So we do it very routine, no? It's very fast, no? It will not take an hour to examine, no? And the patients are usually comfortable. So wag kayong matakot, no? Pag sinabi ko may lenses, kukunan ng pressure, do not be afraid, no? Baka matakot sila.
This is painless naman, Doctor.
Yes, and we do it routinely. The patients go out of the clinic, they drive home, no? Their vision is unaffected. We just tell them, don't rub your eye for a few minutes, no, after the examination. That's it.
Okay, so how long will the examination take?
Well, depende kung ano yung nakikita namin, no?
But
But
it can
usually,
range from
a few minutes
okay.
or 15 minutes
So, hindi naman
tops.
nakakatakot.
No.
So, basically, very short lang naman.
Our glaucoma
short period of
clinics
time.
can be very, very busy kasi sunod-sunod yan. So you can see a lot of patients in a whole day. So the patients come in and out. So it will not take the whole day for your patient. No? So,
Okay. And right there and then ba, makikita nyo talaga na glaucoma right away po? Or you'll be requiring these patients several tests pa that, may waiting time pa prior para ma-confirm pa talaga 100%?
So, may mga pasyente, pasok pa lang, pag-examine mo pa lang, ay, may glaucoma ka, sigurado ka na. Meron naman pasyente na, ay, parang mukha. So, whether mukha kang may glaucoma or we call na glaucoma suspects or yung talagang may glaucoma, whether or not, ano kang category, you will undergo tests. Because, one, we are trying to determine yung kalusugan ng ugat mo.
Yeah.
Okay, so, how do we do that? We have tests. One, structural evaluation. So, meaning structure, kung anong itsura, kung may depekto na, no, yung ugat. So, that's a structural evaluation. Tapos, pangalawa, functional evaluation. So, yung ugat mo, as I said a while ago, ang gawa niya para sa atin ay tumingin. Tingin-tingin dito. Lahat ito, ang may responsibilidad niyan ay yung ugat. So, we have a functional evaluation that will map out your vision. So, basically, the diagnostics is one, to determine if you have a structural problem already, and if that structural problem has translated into a functional problem.
I see.
So, whether suspect or definite glaucoma, you have to undergo this test so that we can confirm,
Yeah.
not only confirm, but also determine your severity, kung mild, moderate, or severe. So, yun yung importante.
And from the time of confirmation up to the time na ima-manage na yung pasyente, ano po yung time interval? I mean, how many days or will it take weeks po ba?
Well, if you have the ability to have your test done quickly, I mean, ang ano kasi, saan available yung mga diagnostic tests. So usually these are eye center based or hospital based. And this will, well, you'll need some appointments for that, no? Para maganda rin yung testing environment, no? Kasi yung isang test, yung functional test, you are definitely involved in this. You will be pressing a button to map out your vision. So dapat kalmado ka, magandang pakiramdam, nakapagkape, hindi inaantok kasi involved ka sa test na ito. So the range, sometimes it might take 3 days, sometimes it may take 2 days. It depends on how soon you can do the test. No?
And these tests are available here in Makati
Yes,
Medical Center.
ay nako. Very, very lucky. No? I'm very lucky. I'm affiliated with Makati Medical Center. So my patients, they have the luxury of having been be able to go to the center and have these tests done completo. No? And then they're well-trained. The technicians are very well-trained and they can teach you how to do the test. Kasi nga, yung isang test, involve ka. Yung mga technician namin, naturuan na namin na ialalayan paano gumawa ng test properly.
I see. Okay. So, Doktora, sa yung mga test po na yan, ay babalikan po natin maya-maya po lamang. So, for now, we'll just pause for a short break. Kaya kayong mga kasambahay ay wag po bibitiw dahil magbabalik po ang Doctors on TV.
Ang tama at maling paggamit ng alcohol bilang disinfectant. Karaniwang ginagamit na disinfectant ang alcohol kung hindi agad makapaghuhugas ng kamay. Inirekomenda ng DOH ang paggamit ng 70% alcohol. Hindi inirekomenda ang mas mataas na percentage dahil kailangan ang sapat na dami ng tubig para makapatay ng mikrobyo. Ang methanol at ibang uri ng alcohol na ginagamit sa industriya ay hindi rin inirekomenda dahil makasasama ito sa kalusugan. Ang alak o alcohol beverages naman ay hindi epektibo bilang disinfectant dahil 40% lang ang taglay nito. Huwag haluan ng bleach ang alcohol dahil nakakalikha ito ng kemikal na kapag nalanghap ay makasasama sa kalusugan. A reminder from UNTV, your public service channel. Mga pagkain na makatutulong magpalakas ng immune system, kamote at talbos ng kamote. Ayon sa WHO, mas madaling kapitan ng COVID-19 ng taong mahina ang immune system. Kaya payo ng DOH, kumain ng prutas, gulay at root crops para mapalakas ang immune system. Ang kamote at ang talbos nito ay dalawa sa mga inirekomendang pagkain ng National Nutrition Council. Ang kamote ay isa sa mga pagkain na may pinakamataas na vitamin A. Ang vitamin A ay nakatutulong mapalakas ang immune system, labanan ng impeksyon at para maging malusog ang respiratory system. Ang kalahating tasa o 100 grams ng kamote ay sapat para mapunan ang kailangan na vitamin A ng katawan sa isang araw. Ang talbos ng kamote naman ay nagtataglay ng iron at polyphenols na makatutulong laban sa impeksyon. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Tinulungan ng UNTV News and Rescue Team ang isang 62 anyos na Amerikano na nahulog sa higaan sa Butuan City. Nagtamo ng posibleng bali sa balakang ng matanda. Matapos malapatan ng first aid ay agad na dinala ang biktima sa ospital.
Kapag ang pasyente ay nahulog at nagtamo ng bali sa katawan, obserbahan ng pasyente at i-assess. Pwede po nating sabihin sa pasyente na galawin ang kanyang mga kamay at ang kanyang mga paa para malaman po natin kung may damage sa kanyang spinal cord. Para maiwasan po ang further damage or injury ng pasyente, huwag po natin itong gagalawin. Hayaan po natin sa posisyong natagpuan natin at tumawag po tayo ng ambulansya at dalhin sa pinakamalapit na ospital.
Ito ang serbisyong hatid ng UNTV News and Rescue.
When we take off,
You get a fresh overview of the news. From city issues to countryside stories, we tell you about celebrations and accounts of destruction. With drones, we give you not just visual narratives from a whole new perspective, but service on a higher altitude. This is our advocacy at UNTV Drone Journalism.
You're still watching Doctors on TV. At ngayon naman po ay pag-uusapan natin kung paano po ang treatment o lunas sa glaucoma. And ito, Doktora, kanina na-mention nyo na po yung mga ibang mga diagnostic measures. And ito po, Doktora, mapakarami po ba nga mga treatment procedures na dapat gawin para po ito ay ma-improve ang pasyente, ang condition ng pasyente?
Yes. Kaya kanina, di ba, nag-mention ako about determining kung ano ang degree ng pagkalala ng inyong glaucoma. Because that will also guide the doctor kung anong treatment ang bagay. Ang maganda ngayon, marami ng developments sa glaucoma. We have newer eye drops coming in, we have newer technology coming in. So, mas maraming, compared to when I started training, mas marami ngayong treatment options, no? So, your treatment options are, one, depending on the severity, you can be started on eye drops. Now, the eye drops can either be to improve the flow outside the eye or to decrease the inflow of fluid, no? So, those are the usual eye drops that we have. So, ang goal niyan is to lower the pressure. Meron rin kaming laser treatments, no? The laser treatments now can either address the blockage. Kung may blockage, may laser kami na maaring gagawa ng maliit na butas, parang bypass for the block. Or there's also another laser wherein we're trying to tickle the cells inside the drainage system. Parang binubuhay niya yung sa drain para mag-work harder. So again, the theory here is that drainage will improve, no? And then now, meron rin kaming, well, those are the usual for the early or mild moderate types of glaucoma. Unfortunately, for those who are in the more severe stages, you might have to undergo surgical treatment, no? So, ang traditional one is the trabeculectomy, wherein we create an opening to drain talaga the mata, or we put a tube. Talagang siya na yung bypass, meron na tayong reservoir ng fluid, no? But coming out soon, we already having the minimally invasive type, no, na glaucoma surgery, and it is developing. It is already available here, no. But those are for a more moderate type. So marami na ngayong options for your patients, no. So pwedeng drops, laser, minimally invasive, or surgical.
Okay, Doktora, itong mga minention nyo na treatment, say the patient has completed all the treatments na needed for his or her condition, no? Can glaucoma be resolved completely? I mean, meron po bang complete healing?
Yun ang nakakalungkot, no? One of the hallmarks of glaucoma is progression.
Despite the treatments?
Despite the treatment, there's always that thing that's parang yan yung sort of parang iniisip namin palagi, lalala, baka lumala. Parang yun sa high blood, di ba? Una, pag may mababa pa yung blood pressure mo, isang gamot lang, eventually nagiging 2 gamot, nagiging 3. No? Same with glaucoma. Some of our patients really, the longer you have glaucoma, the more severe you have, no, na glaucoma, mas dumadami yung treatment na kailangan. So there is progression.
I see. So talagang that's very sad. So
Yes.
and now so this entails regular follow-ups with their ophthalmologists.
Yes,
Okay,
that's
and ganong katagal po dapat ano po yung perfect time interval of in seeing an ophtha?
Okay. First, una, magpa-check up talaga. Kahit wala ka pang alam na glaucoma or anything, a routine eye checkup is really needed, no? So I usually recommend it at 40 years old and above, just to pick up. No? Just to know if you
so
do
dapat
have...
pala nagpapacheck na din
Yes.
ako.
Ano lang
Pero kayo
yun?
ba, doktor, if I may ask, kasi you're an ophtha, so nagpapacheck din kayo sa kapwa niyo ophtha?
Yun ang mga naman. At saka ang maganda naman sa amin, like if we go to conventions and they demonstrate machines, we get to use the machines on ourselves.
I see.
So,
So you get
nakikita ko
examined
rin.
as well.
Oo, so I get examined as well. And I see, uy, healthy pa. Uy, ito na, no? So, yun yung maganda. So, it's really important to have your eyes checked, lalo na kung may kamag-anak ka. And then, how often? That will really depend on how severe your glaucoma is. So, if you're like a suspect lang, may family history ka lang, unfortunately, we do not have yet the genetic testing. Ang maganda sana kung may genetic testing tayo, kunyari ikaw may kamag-anak na may glaucoma, matest kita, ay ikaw pala ay may gene na ito. Magpa-regular check-up ka. Or genetic testing kita, wala kang gene na ganito, and then I can tell you, oh, you're very safe. No, you don't
so hindi
need
porke
to...
magkamag-anak.
No.
So kailangan makita muna na kung positive sa genetic testing.
But unfortunately, malayo pa tayo sa ganyang technology. That
I mean,
is
kahit
a
po
wish
abroad,
list.
wala pa rin.
It's beginning, but it's still mostly a wish
Oh, I
list.
see. So it's basically, kailangan talagang mag-visit sa
visit
mga
talaga.
Yeah.
Unfortunately, kunyari may kamag-anak, mag-visit ka. And then, i-decide ng doctor mo how often. Kung severe, sometimes we see the patient monthly, every 3 months, every 6 months. It really depends on how well controlled your glaucoma is.
Okay, so dapat talaga pumunta sa ophthalmologist and he or she will tell you kung ganong kadalas yung visit mo.
Yes.
Okay, so mapigilan yung progression. And kung kunyari ay you are at high risk, okay, especially if you have several in the family, di ba, na na-diagnose na ng glaucoma, okay, so para at least ma-prevent mo din. And doctor, is there a way to avoid having glaucoma for those who have these risk factors?
Unfortunately, we can't really prevent it, but if you're detected early, we can really slow down the progression.
So it's basically slowing down.
Slowing down, which is very important, especially if you're young, kasi mahaba buhay.
Yeah.
So dapat tumagal ang ugat mo hanggang ikaw ang galing pa naman ng mga doktor natin magpahaba ng buhay. So dapat ang ugat natin mag-keep up, no? Until the very end, no? You should be able to see.
Okay. And Doktora, thank you very much. Ang dami-dami namin natututunan sa inyo. And can you give some parting words to our viewers? I'm sure yung mga kasangbahay talagang overwhelmed sa dami ng information. Ang ganda ng pagkaka-explain niyo, Doktora Mitzi.
Yeah, I try to simplify it as much as possible para maintindihan talaga ng ating kasangbahay. No, and I would like to thank you and everybody for allowing us to share, no, para ma-educate, kasi yun yung isang sa aming advocacy is awareness, no? Awareness for glaucoma kasi nga walang nararamdaman. So kailangan talagang aware kayo na you have to have your eyes checked. And every year actually we observe a World Glaucoma Week every March. So the whole world designates month of March. May week doon sa March na we really full blast. We try to educate as many people as we can about glaucoma.
So our timing is really perfect.
Oo.
Okay, and Doctor, I might want to invite our mga kasangbahay, okay, so to visit you here and check what Makati Medical Center has to offer, okay, and in diagnosing and managing glaucoma.
Oh yes, I'd like to invite all of you, everybody, no? If you're 40 years old and above, if you have a relative who has gone blind or a relative who has glaucoma, please, no? Do yourself a good favor. Come visit Makati Medical Center. We have a very good roster of ophthalmologists who are all well-trained to check your eye, to diagnose, and to treat you. Thank you.
Okay, thank you very much again, Dr. Mitzi.
Yes.
And of course, mga kasambahay, ayan po, napakarami po nating natalakay tungkol dito sa glaucoma, and I hope that really helps sa ating pong, sa mga condition po ng mga glaucoma na mga na-diagnose na, o kaya po sa ating mga kasangbahay naman na ang kanilang mga kaanak ay nagkaroon po ng ganitong condition. And for now, okay, so we'll just pause for a short break. Babalik po ang Doctors on TV.
Tulad ng ibang karamdaman, dapat nakahanda tayo sakaling magkasakit ng COVID-19. Ito ang mga dapat isama sa COVID-19 Home Kit. Thermometer, oximeter, pain relief medicine tulad ng paracetamol, gamot para sa dehydration, disposable face masks, sabon at sanitizer, disinfectant spray, disposable gloves. Para sa iba pang mahalagang impormasyon, manood ng Lifesaver dito sa UNTV, your public service channel.
Ang mga mahina ang immune system ay kasama sa high-risk na grupo kapag nagkasakit ng COVID-19. Isang paraan para mapalakas ang immune system ay ang pagkain ng prutas, gulay at fruit crops. Ang patatas ay inirerekomenda ng National Nutrition Council dahil sa mataas na vitamin C nito na makatutulong magpalakas ng immune system. May taglay din itong zinc, vitamin B6 at isang uri ng alkaloids na mahalaga sa maayos na paggana ng immune system. Tandaan na ang tamang pagkain ay makatutulong labanan ang sakit. A reminder from UNTV, your public service channel.
Naturally, in human norms and standards, those who are weak are despised. But in the Bible, those who are weak are given honor.
Best solution palagi is before you do anything, kneel down and pray. Ask for guidance kung ano yung pwede mong gawin sa buhay.
Alam niyo po, lahat under the sun na maiisip ng tao na gusto niyang malaman, mas makakakuha siya ng magandang perspective from the Bible.
God knows our infirmities. God knows that we are weak. We will sin whoever we are. But the question is not our sins, but our will to do His will. God will always have that compassion. For us to go to heaven, we have first to acknowledge the existence of God. That is the first and foremost thing that we have to do.
Ang isipin natin, God knows best. Sa Kanya ka magtiwala.
Minus God, then everything will be in vain. But with God, every problem will be solved.
Thank you once again mga kasangbahay sa walang sawang pagsuporta, and we are hoping to see you all again next week for another episode. Muli po, maraming salamat sa inyong lahat. Ito po si Dr. Sarah Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsola Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-423133 or 028-824-5217 or 028-813-0320. Organic Acai. Support your health with a 100% organic superfood supplement. organic acai premium blend and acai freeze-dried capsules, rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Clinica Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sarah Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center, Attorney Pilar Nenuga P. Almira, President and CEO, Dr. Saturnino P. Javier, Medical Director, Ms. Arlene L. Sonco, Senior Vice President, Ms. Monica Reyes Dizon, Assistant Vice President, Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.